Hello, I'm Dr. Jack Adrian of ChiroCenter, and today I would like to speak with you about the major causes of peripheral neuropathy, and then share with you a new and innovative approach that is helping many people throughout the country slow, reverse, and in many cases, defeat the misery and agony of neuropathic pain. Neuropathy comes from many different causes and is divided into three primary categories: metabolic, mechanical, and chemical. The largest metabolic cause of neuropathy we see here at ChiroCenter are the individuals who have diabetic neuropathy. Too much glucose in the bloodstream clogs the capillaries in the legs and feet, preventing the nerves from receiving adequate oxygen and nutrients. This short-circuits the nerve impulses, leading to a vast array of very aggravating symptoms. And in most cases, getting to the heart of the metabolic neuropathy comes about when we're able to get the flow of oxygen and nutrients reestablished into the affected nerves. The second category of neuropathy we see here at ChiroCenter are those individuals who have mechanical neuropathy, which results because of nerve compression as a result of a bulged, herniated, decayed, or degenerated disc in their spine. Just like with diabetic neuropathy, this type of neuropathy is also extremely common, and the answer with mechanical neuropathy lies in finding the area of compression and removing it if at all possible. Now, the third largest category of individuals dealing with neuropathy are those experiencing chemically induced neuropathy. These include some very common prescription drugs, war and industrial toxins, as well as those individuals who are or who have been on chemotherapy drugs. Chemotherapy drugs wreak havoc on the nervous system, and it's very important to support the nerves during the drug transition, or as soon after as appropriate, in order to prevent as much nerve damage as possible. In addition to the three major causes of neuropathy, there are also many different combinations of causes that lead to this disease. For example, one may have diabetes and have a pressurized nerve in their spine, or are a chemotherapy patient and have diabetes. There are more than 20 different combinations of factors which lead to neuropathic pain. Now, in order to have the best chance of successfully dealing with neuropathy, an accurate diagnosis must be paired with the treatment needed to support the body. In association with Neuropathy Treatment Centers of America, ChiroCenter is instrumental in bringing to the people of our community a brand new approach that is helping thousands of people throughout the country lessen, reverse, and in many cases, even defeat the agony and misery of peripheral neuropathy. Now, internet time restraints don't permit us adequate opportunity to devote time to each individual treatment, but I would like to share with you just a few of the many procedures we utilize in this new neuropathy treatment system. The mainstay of our peripheral neuropathy treatment program centers around a unit known as the sensory integrator, a painless, low-level form of soft laser where the light from nearly 300 rapid-pulsed, light-emitting diodes penetrates the skin of the feet and legs to assist in new capillary formation and nerve growth. Introduced by NASA, it was originally developed as a way to speed up cell regeneration rates to provide faster plant growth and food production for long-term space missions. Once found to be effective with plants, inquisitive minds began researching it as a way to speed cell regeneration to reduce healing time and diseases of we human beings. They weren't disappointed when they began researching it to be used with neuropathy. This remarkable therapy nearly doubles the rate of human cell regeneration, exactly what is needed in neuropathy to assist in new peripheral nerve growth. Additionally, it serves to release a natural pain-relieving compound found in the soft tissue linings of your blood vessels known as nitric oxide, which also helps bring about relief. This is the part that most of our patients enjoy the most. Our program utilizes up to 3 different frequencies of vibration on different areas of your lower extremities, which further stimulates nerve regeneration and aids in the reconnection of the peripheral nerves with the tissues they serve. Tissue vibration also serves to reintroduce proper sensation and balance, and in many cases further aids in pain reduction. Gentle rhythmic squeezing is often provided for the soft tissues of the feet and calves. This is necessary in order to promote increased circulation into the lower extremities, which helps support nerve rebirth and regeneration. However, we still don't stop here. We also utilize gentle and all-important joint mobilization to remove any restrictions preventing proper joint and gait motions of the lower extremities that many people develop as a result of neuropathy. Some patients with neuropathy also need nerve decompression therapy to remove the pressure off the spinal nerves. And we utilize this in those cases where it is needed, and when necessary, also employ reverse polarity therapy through mild electrical stimulation to aid in the reintegration and correct directional flow of your body's natural electrical nerve currents. The common and agonizing symptoms of neuropathy often include pain in the feet and legs and later in the hands and fingers. Tingling, stinging, burning, swelling, a tight vice-like gripping around the ankles or lower legs, feet or legs that are hot or cold, the feeling of walking on ground-up glass, being stung by bees, or that of having thousands of little bugs crawling all over your legs or feet when none are actually there. Frequently adding to these symptoms are numbness, the inability to feel things against your feet or legs, being unable to tell the difference between hot or cold running water, or the ability to know where your feet are under you as you walk because of a loss of feeling leading to falls, broken bones, and balance issues also leading to dependent care that much of neuropathy eventually develops into. A person can be dealing with only one or two of these symptoms, or in advanced cases experience all of them at the same time. It's important to understand that each individual we're able to accept into our neuropathy treatment program always begins at a different starting point. As an individual with neuropathy, you already know that your results are up to your body's ability to respond to the treatment. And while it's true that no treatment in any branch of healthcare is 100% effective for everyone, know that thousands of people with neuropathic pain across the United States who've utilized this new treatment approach have experienced extremely favorable results. If you're an individual dealing with the challenges of neuropathy and neuropathic pain, don't give up. Give me a call here at ChiroCenter. Let's you and I take a look at what's happening, discuss your options, and see if this new treatment approach may just be the answer you've been looking for. Once again, from ChiroCenter, I'm Dr. Jack Adrian. Thank you for watching, and know that all of us here at ChiroCenter certainly hope that you can be one of our next neuropathy success stories.